This is something, as I understand, you take after you already have contracted COVID. You need to do it fairly quickly. How important could this be?
Yeah, so this is big news, and this is the first time that there's actually an oral option, an oral therapy for individuals that test positive for COVID. The recommendation is to take it within 5 days of symptom onset. And it's been shown in the clinical trials to reduce the risk of hospitalization and severe disease by almost 90%. So traditionally, we've been using monoclonal antibody therapy for these types of patients, which involves patients coming in for IV infusions, which has its own challenges associated with it. So this is the first time that, it's something that patients can take at home.
So once again, this is, as I understand it, after you've contracted it. The goal, I guess, is to avoid contracting it by being vaccinated and fully boosted. Israel now has said maybe we should have a fourth shot. They're authorizing a fourth shot. Does that make sense in the United States, at least to consider that possibility?
In my opinion, I still feel like the push should be for getting the unvaccinated vaccinated. And that's not only in the United States, but that's from a global standpoint. If we can push harder to get vaccines to developing countries and encourage more vaccination, that will decrease the chances that more variants will form, because that's what we've seen with Omicron, right? It was born in South Africa, where there were low vaccination rates, and that will continue to happen unless we, get more of the world vaccinated with their primary series.
Omicron, of course, is relatively new, at least our discovery of it. We haven't known about it very long. How much do we know about it? And let me ask very specifically, it seems to be incredibly contagious. It's spreading at a very fast rate. It's doubling at a rate of maybe even every 2 days. At the same time, is it less severe?
So what we know so far is that it's seemingly causing more mild disease, but that's mostly in individuals that are fully vaccinated or boosted. So that's a key point. Individuals who are unvaccinated, especially those that are a high risk for severe disease because of age or immunocompromise or comorbidities, continue to be at risk for severe disease from any variant of COVID-19. And so while that's promising news of what we're learning, most of that information is coming from individuals who are fully vaccinated and contracting Omicron.
There are also reports that the White House is at least considering shortening, perhaps, the isolation time once you have COVID down from the 10 days, at least for people, critical people such as healthcare workers. Do you have an opinion on that? Does that make sense?
I do think that that's a direction that we're going to need to go in, mostly because of the rapidity with which this is spreading through the community as well as through our workforce. I think, the healthcare workers are vital to keeping the healthcare systems running. And so I do think that it's something that needs to be explored, especially in those that have been boosted and may contract Omicron and have very minimal symptoms. It would be nice to get folks back into the workplace quicker.
Giving us some advice generally, what is the most important thing we can do right now to fight against Omicron? Should we be staying home?
So I think there's a fine balance. We are in a very different position this holiday season than where we were the last holiday season, when we were just starting to give COVID vaccines to healthcare workers and vulnerable populations at this time of the year last year. Now we have the tools to fight Omicron. We have vaccines readily available. We have, for either the primary series or for boosters. We have testing. There's lots of options for testing. And while, there is an extraordinary demand for testing, we have many more testing options now than we did back a year ago. And we also have, ingrained in our systems, the knowledge about the public health measures that are needed to stop the spread of COVID, right? So this isn't new. So it's washing your hands and staying home when you're sick, wearing a mask when you're in public. But that's not to say that you should stay home for the holidays. Small gatherings with family where everyone's feeling well and where everyone's boosted and vaccinated can be done in a safe manner. You kind of want to plan your holidays around who's the most vulnerable in the room, and making sure that you're doing everything that you can to protect that person.
And finally, Dr. Shah, there's some reports that perhaps the White House was a bit surprised about Omicron. I don't know if that's true or not, but we certainly had a lot of doctors such as yourself come on and say, as long as this disease stays out there, it's going to morph. We're going to get new variants. Should we expect more variants to come? And maybe more important, is there anything we can do to prepare for that possibility?
So the variants will keep coming. I agree. The longer that this virus, spreads in communities and is able to replicate and outsmart, the community, it will continue to happen. What would be nice to see is if every new variant becomes milder and milder, and we may get to a point where this becomes more like the common cold. And so I think the way to try to prevent more variants and more spread is really by getting vaccinated. If we can stop the spread, it gives the virus less opportunity to mutate and form these new variants.